interactions with our directors, with the other HODs as well. I hope the interaction was well. So welcoming you all to this feedback session. I must say that our Honorable Minister was very happy to know that you all have come to Tamil Nadu. So the first thing he said is we should meet them because this is where exchange of information happens. We would like to know what is your feedback so that you can tell us about how you felt about that 2-day session and how was your experience. And sir, being very enthusiastic about our activities. Sir is in fact an a renowned personality because sir is promoting health not just towards the treatment and health aspects. He takes care of the lifestyle modification. So this is, I think, one of the very few ministers in the state who leads by example. Sir is an athlete by himself and he runs, he is professionally, he has participated in almost 150 odd marathons across the world and being an enthusiast, yes. So he leads us by example, and today's meeting is basically to listen from you about your feedback and also to see how in other ways we can coordinate with you in future as well. So very warm welcome to you all. Thank you so much.
Next, I request Principal Secretary Health and Family Welfare to deliver the keynote address.
Thank you very much, Honorable Health Minister of Tamil Nadu, who is a very dynamic minister, and I will also like to supplement our MD NHM that our Health Minister has been Mayor of Chennai City for 2 terms and one of the very hands-on minister who knows the subject perhaps more than even all the bureaucrats over here. So, sir, and of course I am Gagandeep Singh Bedi. I am 93 batch IAS officer and MD NHM Project Director Tamil Nadu Health Systems Project, who is also an IAS officer, and our Project Director of AIDS Control, who is also a senior IAS officer. Then our Director of Public Health and the Director of Guindy Hospital, who is also a Dean Cadre Officer, and all the Gujarat doctors who are over here. So I also welcome on behalf of Government of Tamil Nadu to all of you. You have come from a very progressive state and we are very happy to meet you, and this meeting is primarily being held because when the Honorable Health Minister came to know that you are here, it's not we who said, he himself said, I want to meet all of them, I will like to have their views, I will also like all of them, he said that he will also like to host a lunch for all of you. It's a Tamil Nadu style lunch, he will like to host for you. So Tamil Nadu is one of the leading healthcare states in the entire country. We are having 36 medical colleges, to which there are around 62 hospitals attached. In addition to that, we have got 37 district headquarter hospitals, 256 taluk and sub-taluk hospitals. The primary health care is very strong in this state, and we are having, just in the rural areas alone, there are around 1,830 primary health centers. Besides that, there are urban primary health centers. Then there are 8,713 health sub-centers across the state. So this state actually is known for its robust primary and primary and tertiary healthcare. Secondary healthcare is also robust. We are trying to make it further strengthened day by day. And we have got state-of-the-art procedures, technology, machinery. This hospital was just opened about 2.5 to 3 months back. It is further and further. It's a super specialty hospital, and that's why we are actually bringing all the latest machinery and equipments, and well experienced doctors are over here. Already high-end surgeries, a large number of them are being conducted in Guindy Super Specialty Hospital, over here, and they will further come up also. We have got, of course, you would have seen Madurai Hospital, where we have started all high-end surgeries are there, including robotic surgeries are there. In fact, I as Health Secretary keep on getting recommendations from senior bureaucrats, politicians, etc. also, besides our Honorable Minister, to get priority to get appointment in government hospital, which may not be the same position as in many other states in this regard. So we are very proud to be part of the healthcare system of Tamil Nadu. I will also like to say that there are many schemes in this state which are new. For example, I would like to mention about a scheme called Makkalai Thedi Maruthuvam. That's a primary health care scheme which is pioneered by our Honorable Health Minister, started by our Honorable CM 2 years back, in which what we do is, across the state we are having around 10,590 women health volunteers whom we pay, consolidate pay. They go to each and every household, about 20 households they go every day. They check the BP and sugar of the persons, all the adults, and then whoever are having BP and sugar, who are not knowing, they are asked to come to the nearest primary health center and or hospital, whichever is nearby, or a medical college. And then they are asked to take up medicine for hypertension or BP or sugar, or both. It is estimated that in Tamil Nadu, being a predominantly, maybe because of the food habit, etc., around 7% of the people are having possibly diabetes. Around 24% of the population is having hypertension. About 10.1% of the population might be having both BP and diabetes. So our effort is to unearth all the hidden NCD cases and bring them out, which on a large scale basis is one of the biggest scheme in the entire country. In fact, we have already brought out positive cases, about 1 crore cases since the last 2 years, and our minister only also celebrated that milestone, because of which our NCD drug budget alone has gone up from about 90 crores to by another 60 crores extra in the last 2 years. It has gone. And this is a big achievement in our case, in our view, because of the hidden cases of NCDs, etc. There are a large number of complications in the districts which we have been finding, and which we expect that in the future all these cases of amputations of limbs, etc. will reduce. And all the credit for the implementation of this scheme and the conceptualization should go to the government of Tamil Nadu through our visionary Chief Minister and our visionary Health Minister over here. I will also, before I close, I like to mention about one more scheme that which is a personal sort of an effort by our Health Minister. That scheme is called emergency loading dose. That under that scheme, what we are doing is that all the cardiac patients, all the cardiac cases in the villages, if we find that a person is having a heart disease, of course we have got in the PHCs, most of the PHCs are equipped with ECGs, etc. But even the health sub-center, the health nurse, etc., based on the initial symptoms and based on the initial, if they are able to immediately get the ECG, they are all the spokes. So they contact the concerned PHC doctor or the hospital doctor immediately on phone, tell the symptoms, if possibly also tell about the changes in the ECG, and thereafter till the time that patient is moved by the ambulance to the nearest hospital or a medical college, they are given the emergency loading dose. Basically, it consists of 14 tablets consisting of aspirin tablet, Cliptogrel, I'm not a medical doctor, and Esto, what is that? You know the medicine. So we give the medicines to just immediately stabilize the patient during that peak of the moment when he's having a heart problem, and till the time he's brought to the nearest medical college or hospital, thrombolized, and then if the procedure is required to do the procedure. In this regard, I am very happy to say that since June, when the scheme was started, the health sub-centers and the primary health centers have given these emergency loading doses to nearly 3,400 plus patients across the state. 3,400 plus patients, which in our opinion would have saved a large number of lives, in my opinion, and our minister is very enthusiastic about it. This is just to ensure that during that golden hour the patient is actually doesn't go into irreversible damage, and we are trying to stabilize the patient before he is given the treatment. That's the second thing that I like to tell. And of course we have a scheme in which that is called NK48. I'm just telling because you are going to Gujarat and best practices of Tamil Nadu, I thought I should highlight. There is a scheme in which all the road accident cases, this also is not there in any other state. We have actually empaneled 692 hospitals across entire highways, etc., where a person, whether he is having any insurance card or not, is immaterial. We have told that 108 ambulance should immediately pick up the patient and bring them to those 692 hospitals across all over the state, across the highways. And in that regard, for the first 2 days for those road accident patients, the government ensures their treatment and pays up to 1 lakh rupees for immediate stabilization of that road accident victim. So because of this, I am very happy to inform you, this scheme is called NK48, that is Nammai Kakum Napatiyet, that is the Tamil word, that the scheme which will save us for the first 48 hours, that is the name of that scheme. And the government of Tamil Nadu gives the compensation to all those government or private hospitals for the road accidents. Because of which I am very happy and proud to state that when we compared the data, the experiment and control data of 2022 to 2023, the number of fatalities, the death cases has reduced by 7% across the state. So this is a scheme which is a best practice which is going to be highlighted before the Chief Secretary's conference also by the Tamil Nadu government. Our officials will be. If I keep on telling about the best practices, there are a large number of them, but the time being short, our Honorable Minister has to speak to you. I will like to inform you that there are a lot of things that we can learn mutually. We can learn from you, you can learn from us also. Ultimately, it's the society, it's the people of the country who should benefit. So we are very happy to meet all of you, and we also thank our visionary health minister for having actually given the idea of meeting all of you. Otherwise, your visit would have been left unnoticed by all of us, but you are all over here, and once again my good wishes to you, and we look forward to hearing from our more honorable health minister. Thank you. Nandri Vanakkam.
Thank you, sir. Next, I request Honorable Health Minister to deliver the special address.
A very good afternoon to all. I extend a warm welcome to our distinguished senior officials from the Health and Family Welfare Department of Gujarat who are visiting Tamil Nadu as the Health Minister of Tamil Nadu. It is indeed an honor for me to address you today and to obtain insights from your visit as part of your healthcare leadership enhancement program. I would like to express my deep appreciation for your keen interest in understanding Tamil Nadu's healthcare system. Your visit underscores the vital role of knowledge sharing and collaboration in the healthcare domain. Tamil Nadu also takes great pride in this robust healthcare infrastructure. Tamil Nadu has initiated several unique healthcare programs. Early pregnancy anomaly screening at a cost of rupees 86 lakhs, Brachytherapy unit at a cost of rupees 34 crores treating cancer patients. Robotic surgery center at a cost of rupees 34.75 crores. Arinyar Anna Memorial Cancer Research Institute at a cost of rupees 220 crores. Kalaignarin Varumun Kappam Thittam 1250 camps per year with 18 types of specialty screening and treatments. Chief Minister Comprehensive Insurance Scheme covering 1513 disease with 1447 crores families beneficiaries. The Manam program focuses on mental health program. Kasanoi Irapilla Thittam aims to reduce TB mortality. The mobile medical unit hospital on wheels initiative will provide 387 new vehicles to deliver medical camps in inaccessible areas. Pediatric resolution and the emergency management unit focuses on reducing the under 5 mortality rate. Our Honorable Chief Minister announced urban health and wellness centers aim to strengthen urban health care services at the community level with 708 new centers. 500 centers opened by Honorable CM recently. Tamil Nadu has also made significant strides in the field on organ transplantation. We have 13 licensed government transplantation and organ retrieval centers, along with 27 non-transplant organ retrieval centers since 2008. We have successfully transplanted 6,300 major organs and 3,960 minor organs to date. Tamil Nadu is also proud to be the first state in the country to issue a government order for honoring brain dead deceased donors. We firmly believe that sharing our experiences and insights will pave the way for fruitful collaborations between our states in the healthcare sector. Together, we can continue to build a brighter, healthier future not only for Tamil Nadu and Gujarat but also for the entire nation. I extend my heartfelt gratitude for your visit and your shared dedication to enhancing healthcare for all. Thank you.
Thank you, sir. Next, Dr. Rakesh Vaidya, Joint Director Health Department and Mentor of Healthcare Leadership Enhancement Program will give the feedback.
Thank you very much. Honorable Health Minister Sir, Sri Subramaniam Sahib, respected Principal Secretary, respected MD NHM, all directors of various department, project director Shri, staff, participants, media persons, sir, and my dear participants who are here with for this leadership, healthcare leadership enhancement program. Sir, we are honored and we are amazed. And just now I came to know that you are a marathon runner and participated in more than 100 marathons. It is really amazing for all of us. And our team really appreciates such type of leadership you are providing to the state. At the outset, I would also like to thank for organizing such a wonderful debriefing meeting for all of us. So where we visited, and since our arrival, we have been attended very nicely, and all the directors and the staff up to the grassroots level, they provided all the relevant knowledge and sharing. We learnt and we also shared our knowledge. This is an exchange program under the Healthcare Leadership Enhancement Program, which is an initiative under NHM, madam. So under the NHM, and this is the Health State System Resource Center, Gujarat, and Institution of Public Health, Gandhinagar. So all these participants They are composing of Chief District Health Officer, RCHO, District TB Officer, Assistant Professor, Superintendent, ADHO, Head of Department, Physiology, Forensic Medicine, Anesthetics, Quality Assurance Medical Officer, DTO, DTT, all this is a very wide composition. So we are here and for the exchange of knowledge and sir, our visit is really fruitful at the end. And we can say that everybody was thinking, so what is the leadership here? What is the leadership enhancement program? What does it, in the true sense, I would like to thank and congratulate you that this is the leadership that you are providing for the non-communicable diseases, sir. That diabetes, hypertension can be reduced by marathon and by involvement of the volunteers and house to house visiting and checking the BP and diabetes, blood sugar, etc. So really, and for this communication, this will be communicated to all. Good practices, best practices must be communicated to all human beings in the society, irrespective of the caste and creed. Sir, I think that you have also visited the Statue of Unity that in Gujarat in conference where the best practices were discussed at length, sir, in Gujarat, sir. Yes, I just came to know and I was also there, sir. Really, sir. But the objective of our this program is that to identify the gaps, sir. All we are doctors, and doctors they know how to treat. But as a leadership at every level, from the supervisory cadre, from the district at the district level, at the state level. So how to face the challenges, how to communicate the right message in the community for the welfare of the society is very important. And COVID is the example, and many examples can be quoted. As Principal Secretary said, that many programs also in Gujarat like Beti Bachao program, leprosy elimination program, TB program, all the programs, if you list more than, I can say 50 programs are running there, and all are trying their best to achieve the goal. Thanks that Gujarat has also attained the Sustainable Development Goal. Gujarat is first in Niti Aayog ranking, and as per the last report. And our indicators, as well as the Tamil Nadu indicators also shows that all the efforts are being made by the different departments, not only by the health department. For example, yes sir, we know that the health, all are working for the health, all departments. We will realize later on also, whether it is agriculture department, electricity department, road building department, any department, ultimately the result comes, they all converge at the health departments, and health of the human being is being improved, sir. So this is really wonderful. And sir, this leadership enhancement program is also give the leadership and address the challenges, as I said. And sir, we visited various facilities, and really from 8 a.m. to 8 p.m. nobody was tired in the evening. We were so delighted. Yes, we are all officers are also visiting in Gujarat at the periphery, etc. They are also learning in the periphery, implementing all the programs, national programs, new initiatives. Also, we have also seen the enthusiasm of the health worker at the periphery. Also, various schemes have been implemented here, have been launched, and new initiatives. Although there are some different names, we can say we are having the PMJY dotted with the Kasturba Poshan Sahay Yojana for the nutrition of the antenatal and postnatal and the infant also. Even so many schemes in somehow other names are also being implemented in the Gujarat, sir. So on the day one, we also visited health system that is called Telemanas. This is really wonderful. This visitor health system project emergency management services, which I remember His Excellency late APJ Abdul Kalam also inaugurated 108 in Gujarat in 2007, and which is also working here wonderfully. And there are various dropback services for the mortuary, 104, 102 and 155, 377. These services are round the clock, and GVK EMRI also supporting us there in Gujarat and funded totally by the Gujarat government. So in visits, for 3 days visit, we learned a lot, sir. And we shared also what Gujarat is doing in various areas of the districts. And super specialty hospitals, this robotic surgery, master health checkup, radiotherapy, we just mentioned also. We visited, we saw this, our team learned a lot, and high-end surgeries are being performed there, and really the devotion of the doctors and staff nurse. On the top of the situation, I would share that the cleaning sweeper and the safai karmachari, we call them, they are also devoted maintaining the cleanliness for the quality and for the prevention of the infections. And latest technology is being used for surgery, for treating the cancer patients, as we are also in the MP Shah Cancer Hospital, BPL and APL and all the PMJ cards are also being used in Gujarat. We are also having super specialty hospital, UN Mehta and kidney distributed transplant, and all the other high-end surgeries are being done. And one most important thing is that the follow-up of the cancer patient from the hospital after discharge is being regularly done, sir. And all the patients were very happy. This is very good point, sir. Sometimes we may drop out or left out patients are also there. And after that, sir, our team visited Rajiv Gandhi Government General Hospital. We met Dean of the Medical College, he's a pediatrician, awarded with prestigious CM award for excellent and devoted work. So really, this is an honor for our faculty. And critical care block under ECRP, trauma unit, accident and emergency care unit. All these visits, we shared our knowledge, what we are doing in Gujarat, what you are doing, and how we can actually exchange the knowledge. And the emergency COVID response project phase 2 is also functioning very nicely. And most important thing we are here is also there walk-in chest pain clinic. Any person having chest pain can immediately rush to the hospital and will be investigated completely without any Q&A anything, and cardiologist will examine the case. And sir, Nandivaram upgraded UPSC, as you said, sir. Medical officer was working as a civil surgeon also. The senior civil surgeon is also serving as a medical officer. No difference, because all are devotion. This shows the devoted, and so many patients were admitted. So the amazing thing here, Nandivaram, that the delivery conducted, grandmother, daughter and daughter, 3 generations delivery occurred there, sir. And it was established in 1962, really, and I think that was a sub-center in 1962, sub-center plus after that the PSC and PSC2 upgraded CSC, and the doctors are really devoted, and they are serving the noble cause, sir. And after that, sir, Tambaram District Hospital, where 6 gynecologists, 4 pediatricians, surgeons, physicians are providing round-the-clock services. 200 to 300 deliveries with the cesarean sections are being performed, helping the reduction of the maternal mortality and infant mortality, sir. These are the indicators. And on day 3, upgraded PSC, that is upgraded urban CSC, Punnamalli, sir. So maternal and child health wing, immunization clinic, blood storage unit, laboratory, facility for yoga, digital X-ray, sonography, TB center, etc. These all facilities are available in one campus, sir. This is very important that everything is available there in a walking distance, stone throw distance, sir. And one thing important is that the Siddha herbal medicines are being provided. We are also providing in Gujarat, sir, but Siddha herbal medicines to the antenatal cases in the same premises, and yoga facilities with the vibrant color mattress, not the chemical mattress, sir. That is very attracting, eye-catching, sir. So these are the few points, few observation of our team, sir. Really, I must thank you, state, district, sub-district, for their commitment and hospitality. And we observe that the improvement is in process. As this, not we look forward in health, but we look up in the sky. So our graph will go directly in the sky, not horizontally to vertically. And the utilization of the technology is also a very good example here. Access and coverage up to the village level is also important. Several proactive steps towards promoting wellness as a key component of this primary and tertiary healthcare. This is really important. And two or three points I would like to share, that in Gujarat, all the health points, all the health process and all the inputs have yielded Beti Bachao Beti Padhao program in Gujarat, which was launched. So sex ratio at birth in 2001, the census report for our sex ratio was very skewed. But at present, our data shows, NFHS data shows a sex ratio at birth has improved from 906 or 1818 to 955. That is the outcome. That is the devotion of our health staff and awareness generation. So this also shows the very good leadership of our state and administration commitment. Sir, as far as the leprosy is concerned, with Mahatma Gandhi served leprosy patients. His patient was Parchure Shastri. It was 24 per 10,000 leprosy, per 1,000 leprosy cases, which reduced to in 2008, 2009, I can say, it was less than 1 per 10,000. That means prevalence rate of leprosy was reduced. For that, the then CM has to close that leprosy hospital, which Mahatma Gandhi dreamed in those days. I don't want to inaugurate this hospital, but I want to close this hospital as the number of patients must be reduced. So we started serving in last 20 years, sir. This is a very good example. And as a person, as a doctor, I feel proud of that. Leprosy patients are reduced, and hospital which was constructed in a 125 acres lands, that was closed now, sir. And fulfilling all the dreams of Mahatma Gandhi, sir. And one thing, we can say last year our Honorable CM started the blindness rate, that the cataract surgery target we achieved more than 400%. That means we identify all the cataract patients, sir. All the cataract patients, and we put under by developing a software, we provided the facility, we facilitated and provided the cataract surgery. So the blindness rate, total blindness rate is also reduced from 1.07 to 0.36. That means the blindness, Mukhyamantri blindness, that is Motiya Andhatva Mukta Gujarat Mahabhiyan, which was we are having the backlog of more than 2 lakh of surgery cases. So, sir, here we are also observing in Tamil Nadu that the Tamil Nadu system, infrastructure and health program implementations are also robust. So, really, our visit, and sir, you are this program, there's a leader by example. Everything, non-communicable disease, everything, sir. We must thank you, sir, by heart, sir. And our whole team is indebted to you for you have given time and appreciated us, and we are honored. Thank you very much, sir. And my humble request to all of you to again visit Gujarat, sir, and guide us also. As mutually we will share our knowledge, sir. Thanks a lot.
Thank you for your feedback, sir. Next, Dr. Shalini Bhatia, Additional District Health Officer, Kheda District, Gujarat, will give the short feedback. Thank you.
Namaskar, sir. Respected Honorable Minister, sir, Minister of Health and Welfare, respected Principal Secretary, sir, respected MD NHM ma'am, respected Project Director, sir, respected Director, media friends, and our whole Gujarat team. My respected Honorable Director, sir, has already covered many points, in fact a lot. Just a few brief things. We are very happy with this interaction. We feel really honored that we have seen so many good facilities. As a part of knowledge exchange program, we visited those facilities, and just a few points. Looking at the infrastructure, sir, Tamil Nadu has used really very vibrant colors in all the facilities, from roof to walls, from curtains to tablecloths. Everything is very vibrating, very colorful, and it is giving a very good ambience to the patient, to the environment, to everybody, even working there also. Second very important thing we have seen, very good, that is a no anger zone. The no anger zone was really very appreciated thing. Third was, sir has already discussed, the integration of Siddha, traditional medicine for antenatal care is really very well formulated. We have visited immunization clinics, sir, and the look of the clinic, the toys were there, and the child will never feel like he's being injected or being immunized, so it was really nice. As per family planning services, we have visited one of the maternity center. We interacted with one of the patient, postnatal patient. She told us about the real good services. As we are giving in Gujarat, we are also providing the birth kit. Tamil Nadu is also providing the same birth kit. And the lady was very happy. She was very contented and she was thoroughly given all the information about the family planning services. Maybe that is the reason we are having such a good TFR. Then we have been shared by a concept of sensory garden with the dean sir of the private medical college. That was really good, very appreciable. The door-to-door delivery system of medicine was really nice. We have visited and we have seen that, and I think I have shared enough. Thank you. We are all very grateful, very thankful for such a wonderful interaction. Thank you,
Madam. Next, Dr. Chinmaya Shah, HOD Physiology, Bhavnagar Medical College, Gujarat.
Inya Kalai, Vanakkam to one and all. Respected Health Minister sir and all the dignitaries on the dais. Sir, we have visited lot many things as already shared by both of our senior officials. I would like to stress upon Tamil Nadu Accident and Emergency Care Initiative. It is really an excellent initiative, and we came to know that it has reduced a time from 1.5 hours to right now only 33 minutes. Means a patient is stepping into the OPD and he is on the angio within 33 minutes. So it is an excellent initiative, sir. Because right now we are seeing that and even after COVID also that cardiac deaths are increasing, and it is saving lot many life, and this is excellent. During our visit, sir, we have also shared our initiative of Gujarat with the health professionals in there. So I would like to share few of them. Number one is Hospital Patient Care Improvement Program. So it is a combined program starting from entry of the patient to the discharge of the patient, totally focused on patient, no any other thing. For example, if patient has to go from one ward to another ward or transform from inside hospital also is taken care of. So like keeping a patient in mind, this whole program has been created, and we have a health team at the state level, district level, even medical college level, and we have a separate whole infrastructure and HR for the same. The second initiative, as you also have, that is organ donation. Sir, we are happy to share that today we have 108 total center of organ retrieval and organ transplant combinedly, and we are increasing day by day. It will be not overwhelming if I say that within a week minimum 2 lives we are saving in the organ donation, and so much is done by public awareness, capacity building, as well as PPP model. It is excellently working right now, and we are happy to say it gives a sense of satisfaction to each and every, starting from class 4 to class 1, that we are able to save the life of people. Then second important part is a self-help group. Sir, as sir has rightly said that we alone can't do much if we want to go for the health. So we are taking in confidence our collector, DDO sir, and all the different branches of our healthcare and our government. So ultimately, and it is an incentive based, we ask them that if you are a part of this self-help group and you improve our indicator, so much incentive is being given, and everybody likes the incentive, and so the program is getting very fast. One more initiative is socio-behavioral change. We have state-of-art ones in India. This is the first in India behavioral insight lab under SSSRC, and this lab is looking after human behavior, and we know that one treatment doesn't fit to all. The same way, one communication module will not fit to all. For example, you have a problem of vaccine hesitancy. If you have a problem of malnutrition, you have a problem of adolescent health. So with the help of this behavioral insight lab, we are able to tailor the program as per the need. Sir, during this visit, we have seen that we have an excellent blend of initiative. If we come together, and as rightly said, together everyone can achieve more. As a team, Gujarat and Tamil Nadu can do the best. And thank you very much, sir, for again providing leading by example, because during this even this meeting also we are learning, not only for 4 days. And again, as everybody said, we would like to invite you to Gujarat to be part of a healthcare team of Gujarat and Tamil Nadu. Thank you very much, sir.
Next, Gujarat doctors team wants to felicitate Honorable Health Minister Dr. Jalavi Panchamiya, Senior Professor and Lead for this program, will felicitate Honorable Health Minister with the memento.
Ma'am.
Next, Dr. Rakesh Vaidya, Joint Director Health Department, Gujarat, will give memento to Principal Secretary, Health and Family Welfare.
Scan the receipt, sir. Scan the receipt. That's it.
Dr. G.C. Patel, Mentor and ex-Regional DD for Ahmedabad, will give memento to NHM MD. Dr. Rakesh Vaidya will give memento to Tansax PD. Dr. G.C. Patel will give memento to TNHSP PD. Dr. Rakesh Vaidya will give memento to DPH.
No, sir, it's different. Thank you very much, sir. You have elaborated excellently nicely.
Vote of thanks by Dr. Parthasarthi, Director, Kalanjar Centenary Super Speciality Hospital.
Good morning to one and all. On behalf of Government of Tamil Nadu Health and Family Welfare Department and Kalanjar Centenary Super Speciality Hospital, I express my immense pleasure for thanking our Honorable Minister for Health and Family Welfare Department for giving me an opportunity to address this prestigious event. Always, Tamil Nadu is the role model in healthcare under able leadership and guidance of our Honorable Chief Minister of Tamil Nadu. Currently, Tamil Nadu is innovative in initiation of next generation health schemes and services among all states. I thank all the doctors and healthcare officials from the state of Gujarat for honoring us by visiting Tamil Nadu. I thank our respected Health Secretary, MD National Health Mission, Project Director THSB and TANSAC, Commissioner of Food and Safety Department, Director of Medical Education and Research, Director of Medical and Rural Health Services, Director of Public Health and Preventive Medicine, press and media, and other event organizers and workers of Kalanjar Centenary Super Speciality Hospital wholeheartedly. Thank you one and all.
Come back. Hello.
உணவு பாதுகாப்புத்துறை சார்பாக திருவள்ளூர் மற்றும் ஆவடி ரயில் நிலையத்திற்கான ட்ரெயின் ஸ்டேஷன் சான்றிதழ்களை தெற்கு ரயில்வே அலுவலரிடம் மாண்புமிகு மருத்துவ மற்றும் மக்கள் நல்வாழ்வுத்துறை அமைச்சர் அவர்கள் வழங்குகிறார்கள்.
Sir. எங்க சார் பேக்ல
திருவள்ளூர் மற்றும் ஆவடி ரயில் நிலையத்திற்கான ட்ரெயின் ஸ்டேஷன் சான்றிதழ்களை மாண்புமிகு அமைச்சர் அவர்கள் திருவள்ளூர் மற்றும் ஆவடி தெற்கு ரயில்வே அலுவலரிடம் வழங்குகிறார்கள்.
சார் நீங்க அந்த புக் பாருங்க சார், அந்த புக் பாருங்க சார். நீங்க என்ன படிக்க சார் நீங்க அந்த புக் போங்க சார். நீங்க அப்படி இந்த வருவீங்க சார். சார் நீங்க அமைச்சர் தான், நீங்க தான் படிச்சிருக்கீங்க. அப்படி இல்லைங்க சார், கொஞ்சம் பின்னாடி வந்துங்க. ரெண்டுமே எல்லாருமே பைக் போட்டு
I request everyone to rise for national anthem.
नायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा दव शुभ नामे जागे दव शुभ आशीष मागे दागे तव जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
கூட்டிட்டு போலாம் ஆமா ஆமா நம்ம முடிச்சிட்டாங்க போய் ஒரு கோடியே 44 லட்சமா ஆமா அதுக்குள்ள சார் நமக்கு ஒரு கோடியே
सेक्रेटरी के बदला मेजर चीफ सेक्रेटरी हेल्थ डिपार्टमेंट कॉल
போலாமா கொஞ்சம் அப்படியே கொஞ்ச நேரம் போலாமா போலாமா அறுபது தானே 60 டாக்டர் தானே 60 தானே என்ன சார் 60 டாக்டர் டோட்டலா 60 டாக்டர்
60 சார் 60 டாக்டர்
60 போலாமா குஜராத் மாநிலத்திலிருந்து அந்த மாநில சுகாதாரத்துறையைச் சேர்ந்த அலுவலர்